Hello, radio listeners. Welcome back to the Medical Freedom Show. This is your host, Heather L. Martin. Today I am talking with Dr. Henele, the founder of the Energetic Health Institute and author of Energetic Health Volume 1. Thank you for joining us, Dr. Henele.
Oh, thank you so much for having me, Heather. I really appreciate it.
Just very briefly, I'm curious about energetic health and a little bit about your background. Can you explain to us a little bit about what that is or maybe what your book is about?
Absolutely, I'd love to. So I'm sitting in class in medical school, and I had an epiphany. You know, we're going through a textbook of pathology, and it's like one of these, like the binder's like 3 inches thick of every possible thing that could go wrong, and it's creating just a total class of hypochondriacs because you're like, oh my God, I have that, I have that, I have that. And I'm looking through all of these symptoms, and the one symptom that every single pathology has is fatigue.
Mm.
So, as luck would have it, my very next class was in biochemistry, and we were getting into the cell, and we were getting into mitochondria and the production of ATP. And I have a huge background, big fan of Chinese medicine and Ayurveda and prana and chi, and seeing how all these things are the same. So I thought to myself, I wonder what would happen if we just gave the body everything it needs to produce energy. And sure as shooting, using that philosophy, I've had tremendous success clinically, tremendous success with my students who are using the same methodologies of saying, let's focus on energy production. If we get energy producing in the body is designed to heal. And it's
Mm-hmm.
such an incredible, incredible thing. So that's really the foundation of what energetic health is about, the production of energy. But we don't just limit it to nutrients and B vitamins and this food or that food. It's
Mm.
also about our lifestyle habits. It's also about our internal dialogue and what we think and what we say. They all come together to help
Right.
maximize the production of energy.
Mm-hmm. Very interesting. Makes me
Mm.
want to check out your book. So, I know you were drawn to my show today because of the vaccine topic, and you
Mm.
were talking a little bit before we went on about your research into vaccines. Can you
Mhm.
tell us a little bit about that? You mentioned the evidence-based research, and I'd like to talk about that more here on the show.
Well, one of my colleagues, Brittany Cara, has a saying, the truth is hiding in plain sight. And we found that to be true. When we go to the CDC's website, and we go to and we look up the vaccine media and excipient summary. It's a very important document for your audience to be aware of. The vaccine media and excipient summary. It has a list of all the ingredients that are actually in vaccines. And I want to be very clear with the audience. I do my best to not be pro or anti anything. I do my best just to be an educator.
Same
And,
here.
right.
Good
And
company.
so, right. And, sometimes we get slung with arrows, for being the messenger, and that's okay,
Hmm.
but when I look at these ingredients, my first question becomes, can we do better?
Yeah.
Can we do better than having formaldehyde?
Hmm.
Can we do better than having aluminum? Can we do better than thimerosal being able to be added after production without being listed on the label? This is on the FDA's site. Can we do better than the MRC5 aborted human fetal cell? Can we do better than the WI38 diploid? Can we do better than these ingredients?
Exactly. That's what I always think too. And what you're saying right now resonates with me so much because I feel that the greatest tragedy in all this is that science is being withheld. It's
Hmm.
not that we're really using science and applying science in the way that we should be. And the world of science is just full of so much ego tripping and politicking that it's so far from actual science. Like one of the things I'd like to see in a medically free world is for those peer reviewed medical journals to be
Hmm.
more available.
Mm-hmm.
because my third grade science teacher would rip apart some of these experiments that are
Mm-hmm.
being published because they're not really following the scientific method.
Agreed. Totally agreed. I think when you look at the entire situation of how things are being tested, we know definitively that there have been zero double-blind placebo tests for these. So we have
Right.
no gold standard for comparison. We know that in many cases, and my concern with this new COVID vaccine that's being fast tracked, it's not even
Hmm.
going through animal studies. It's going directly to human volunteers, which is very similar to the
In
Tuskegee
Africa,
experiment. Well, this is one of my
yeah.
problems. Where do we test these? We test these in third world countries, most
Hmm.
often on children,
And people
and
who don't have the resources to deal with a lifetime of disability that might
right,
result.
let alone the breach of informed consent that goes on, with
Yeah,
it. And I think what we are seeing is an awakening in people right now that I'm personally
I
really
agree.
excited about. It's like, why can't we ask a question? One of the fundamental things about science is it's never settled because there's always more to learn. You
Mm.
can't settle something when there's more to learn about it.
Right.
So,
That's why I think the culture of science really needs to change, because
mhm,
right now you have older scientists who want to protect their viewpoints
mhm,
and their theories and don't want
mhm.
anything to intrude upon this, because now it becomes a crisis of ego.
Yes, very
When I
true.
think maybe we need to celebrate scientists who are the most open to change and the most open to changing their minds based on new data. That should be really what's celebrated, because that's what's truly scientific.
One of my favorite scientists, George Washington Carver, right? The
Hmm.
peanut, right? Peanut guy, right?
Yeah,
He had an axiom that went, I reserve the right to change my mind in the presence of new information,
yeah.
but opinions are not information. Facts are information. And when I get into this topic with folks, I ask people to listen very intently for a key phrase, because this will tell you whether a person is talking scientifically or whether a person is talking from a faith-based model. And I'm a fan of both. I am actually an ordained minister as well. All right. I'm a big fan of both, but I'm a big fan of there being a clear distinction, because faith doesn't require any objective proof for it to be believed in, and that's the key word. So when you see the World Health Organization saying, making their slogan, in vaccines we trust, that is a belief statement. That's a faith statement. That's not a scientific statement. A scientific statement is, the data says this. you know a faith-based statement always leads with the same phrase, I believe. And whenever you hear a doctor, whenever you hear a person who purports themselves to be a scientist leading with the statement, I believe, whatever follows it is not science. It's faith based. And there's nothing wrong with it, but it's not science just
Right.
because it's coming from a scientific entity,
Hmm. Yeah. Hear
right?
that a lot now in the
You
medical community when it
so
comes
much.
to the opioids and the pain medicine. They say, I'm not
Hmm.
comfortable with, or I don't believe in
Hmm.
this much medicine. Well, maybe they should listen to the people who've worked with it for decades for their chronic health condition. Anyway, getting a little sidetracked
Yeah,
there.
for sure.
But there's something I want to kind of go back to a little bit. When you were talking about the energetic health, you were talking about nutrition, and
Hmm.
that's something that really astounds me, of how little knowledge of nutrition there
Hmm.
is in
Hmm.
the medical world, in the mainstream
Hmm.
medical world. Like, most doctors really don't have a very good understanding of basic nutrition.
Hmm.
And also, like, when you go to a hospital, say if you're in a hospital, everything is processed food that they're giving.
Hmm.
Everything is commercial and full of preservatives and artificial colors and all these things that we already know are unhealthy.
Hmm.
But you can see it in just the food that is given to patients in the hospital of where they're coming from. It's very corporately driven, and you've got all of these chemicals. And like when you're talking about the vaccines, that's exactly my thought on it. Is like, let's give this research over to the people who are developing the health food and who understand plant-based equivalents and nutrition, and we could really do so much better. We could have much safer, more effective vaccines. And because of the lack of medical freedom, because vaccines are pushed through a system of mandates, they don't get the research and development that such a technology would require, that it deserves, and certainly not the follow-through. There's absolutely no follow-through. People are just vaccinated en masse, and then any negative reaction is anecdotal evidence.
Right. And I think there's a couple things in there. First thing is, when we talk about doctors, and we're talking about allopaths, medical doctors, not naturopathic doctors. What we're talking about is, there was a study from 2009 by the National Academy of Sciences, and this is available on PubMed. They asked for every medical school to give a minimum of 25 hours, and we're talking out of about a 6,000 hour education. All they were asking was 25 hours on nutrition for every physician. Less than 20% of the schools that responded met that minimal requirement. So what you have to understand, and your audience has to understand about an MD, is it's not that they're ill-intended, they're just not educated, they're undereducated. For a comparison, I run a holistic nutrition program that's been approved by the Holistic Nutrition Credentialing Board, so that my graduates are eligible to become board certified in holistic nutrition. And that they have over 1,000 hours of training to get to that point. Most MDs don't even have 25 hours of training in nutrition. So they're not qualified, unfortunately, and I think this is a big error on our part, but they're not qualified to speak intelligently, scientifically, evidence-based on nutrition. And unfortunately, we're seeing that in 2020 in full view, because the two greatest risk factors for fatality with from COVID-19 is advanced age, but not just advanced age. It's advanced age with a comorbidity. And when you understand the human body, you understand that a comorbidity is by definition a nutrient deficiency. And what my biggest thing, I've been talking to medical directors at health departments. I've been, messaging and emailing elected officials. I've been shouting from the rooftops since March. Social distancing, fine. Masks, whatever you feel on it. If you want to wear one, wear one. All right, I'm not going to challenge somebody's First Amendments, right?
Here in New York, it's mandated right now.
I know, right? Another mandate. But my
I was
question,
wearing mine before the mandate. I think the mandate's a little excessive, but
right.
Nothing wrong with stores requiring masks for people to come in. They require shoes, they require shirts.
I don't have any problem with any of that. I'm medically exempt, because if I wear a mask, I could go hypoxic and go into engage my vaccine
and the stores
injury.
really do need to make a way for people with certain conditions or certain disabilities. I went through that during this pandemic, trying to find certain supplies for people in my family who couldn't go out and go to the stores, and the stores are just telling me, well, wait here for 3 hours in the store and maybe the order, like, come on, you're telling me to sit in the store for 3 hours?
That's the worst thing. That's the worst decision.
Yeah, and instead the policies are causing people to have to go in the stores more. So, there's that.
What if we told people, here's some good guidance for wearing a mask, and here's some good guidance for nourishing your immune system as well?
Yeah.
That's been my move. I'm like, look, whatever you want to do and whatever you got to do, I understand, and I'm all about it. I have no judgment. I refuse to be PC shamed, and I refuse to PC shame anyone, right? We're all in this together, right? So if we're all in this together, Why aren't we giving Americans information that we know works? I keep sending this reference out from Linus Pauling
Mhm.
Institute, which is our premier nutritional research center in the country. They have a study. They have a paper that they authored on the immune system, specifically how nutrition interacts with the immune system. Over 267 peer-reviewed evidence-based references to it. It's as solid a work on the immune system and nutrition as I've ever seen. And I share this with politicians. I share this with heads of the different health departments. Crickets. And I'm like, why can't this be right alongside your recommendations for masks and social distancing? Because my
Right.
suspicion is that if we taught Americans that all you needed to take was, and I'm not saying this cures anything. I want to be very clear, everybody. Okay, I'm not saying it's cure. I'm talking about empowering your immune system. Okay, very different things, and a very important distinction for me legally. But what if we asked Americans to take 1,000 IUs of vitamin D, 1,000 milligrams of vitamin C, and 25 milligrams of zinc a day? We have studies from around the world that show the efficacy of it. But
Mhm.
what if we did that? What would our numbers look like? You know, that's, and we may
Right.
never know, but what if, right? We can
And it's
dream.
so accessible too.
So accessible and so inexpensive.
Yeah. I know it just boggles my mind what things are done that are totally ineffectual and what things that are just so simple and could be
Mhm,
so widely effectual are just,
mhm,
not being done, like making sure that like stores prioritizing pre-orders instead of
mhm,
walking into the store.
mhm,
It's backwards. They prioritize people walking in the store over the people who will take the time and put the money up front and place the order ahead of time for something that they really need. And that just doesn't really make much sense to me unless the end game is mass depopulation or something along those lines, which are
there,
a lot of our so-called elite are obsessed with, which I think is
well,
also a lack of science, because if anything, science shows us that there is so much abundance and so much
yeah,
more abundance to be had.
yeah, I agree. And without naming any names, I think
Yeah.
we all know the players that
Mhm.
we're talking about with that, and they've outed themselves enough, to
Right.
at least bring up reasonable suspicion of true intention. And I think when we get into some of this, it's like what we don't have to make dramatic changes. We just have to reconnect with some things that we've forgotten that were actually very important. Like, here's an idea: community gardens, and having your own garden if you have some land, using your front yard instead of it being a lawn, it being something
Mhm.
that produces food. Because that's what's so incredible about all the microorganisms and the fungal networks and the mycorrhiza that are in the soil, is that Mother Earth is ready to provide at
Mhm.
all times. I mean, the magic is, I mean, think about this. You put a little seed in some dirt, and what do you need? A touch
Yeah.
of water, and the magic explodes. And guess, here's a little thing for your audience. Guess how that seed starts to grow? It's all due to mitochondria that have gone dormant. All it takes is a little water, boop, and then they
Mhm.
start producing energy, and boom, we have growth, and that turns into food that helps us. It's a beautiful miracle that life is, and all we have to do is learn to live in balance with it. That's
Mhm.
all. But we're,
Even when you look at the landfills and a lot of the trash that's there, a lot of it is just really raw material, ready to
mhm.
be repurposed, ready to
Yes.
build our world up. That's actually
Yes.
value sitting there.
Mhm.
Just haven't figured out the systems yet to implement that.
Right.
So, radio listeners, you are listening to the Medical Freedom Show with Heather Martin, and I'm talking today with Dr. Henele, the founder of the Energetic Health Institute and the author of Energetic Health, Volume 1, which I'm growing more intrigued by the minute about. Um, so anyway, I also want to get back to the subject of how the COVID-19 vaccine right now is,
Hmm.
they call it fast tracked.
Hmm. Hmm.
And really, this is a very reckless way of developing a vaccine. You mentioned in the first segment that it hasn't even gone through animal trials, it's going directly to human trials. I myself am not a big fan of animal trials. For one thing, animals have very different systems
Hmm.
than human beings,
Hmm.
but the way it's being trialed right now is very concerning. I haven't really had the time to research it as much as I would like, but I have been seeing some articles and headlines about trials starting in Africa.
Hmm.
And do you know anything more about the trials, Dr. Henele, like how they're going about this development?
From what me and some of my colleagues have been able to unearth, and that's another one of our problems, is that so much of this is shrouded in secrecy. You know, this
Mm,
should be probably the most transparent process ever undertaken.
absolutely.
But one of the things I educate my audience on, especially in a class I teach on vaccine education, is that the process that companies go through is to get FDA approval for release is very suspect. You know, there's very little oversight. The companies are allowed to police themselves in effect, and there's no independent um, duplication of their findings, so that it can be confirmed by an independent body. It's basically the company goes to the FDA, says, hey, here's what we found with our trials, what do you think? And the FDA can take
Hmm.
that information and take it at face value, or say, hey, you know what, this doesn't look good, we need you to go back and rerun this, you know, as
And
far as
just
the trials
before the
go.
show, we were talking a little bit about certain protections that
Hmm.
the FDA has from
Thank you
liability.
for, yeah, thank you for bringing that up. And it's not the FDA. The FDA is, you can't sue the government
Right.
on things like that. Like that's just a non-starter. But what
Untouchable.
but I would love for your audience to go and investigate 42 USC 300 AA dash 22. Let me say that again. 42 USC 300 AA-22.
Okay, I
It's
wrote
a
that down.
it's a provision in the 1986 National Childhood Vaccine Injury Act. How interesting that the act has the name injury in it, right? But so many
Hmm.
people refuse to believe that people can be injured by this product. What that clause does, the dash 20, the 300 AA dash 22 clause does, is it gives complete civil immunity to every vaccine manufacturer. You cannot sue. Let me take that back. You can sue. The maximum you can sue for is $1,000, and a judge is required to throw it out by law upon receiving it. So it's in effect, you cannot sue a vaccine manufacturer for any injuries your child or yourself I don't want to say received, but you get the idea, were caused by the product. Now, there's a process to go through this. You have to go and first report to Vaccine Adverse Events Reporting System, which is a federal entity. You can look up vaers.gov. But you have to go to Veris, and there's criteria for reporting an adverse event, and there's hundreds of thousands of line items there. And here's the funny part about it, Heather. Guess how many doctors are aware that Veris even exists?
Probably
Under
not too many.
under 1% of physicians are aware that Veris exists, let alone have been even mildly trained on how to identify a potential vaccine injury. Why? Because I almost no medical professional has ever read a vaccine insert to know what the side effects are, the contraindications are, that if a baby is born premature or a family has a history of neurological issues, that it makes the child exempt in the actual document, because most people aren't given that vaccine insert prior to and given an opportunity to ask informed questions of their physician, or here's the crazy thing, of their pharmacist. That's one of the most ridiculous things to me, that a pharmacist can now administer a vaccine. A pharmacist can't administer any other medical treatment, but they can administer a
Right. They can't do
vaccine.
any screening tests.
They can't do anything like that, but they can
When I
give a
had a
vaccine.
guest on my show several months back who is the mother of two children
Hmm.
injured by vaccines, and she discovered after the injury that there was a mitochondrial
Hmm.
condition in
Hmm.
her family, and like had the children been screened,
Hmm.
it would have counterindicated them being vaccinated, like they were more vulnerable to the
Hmm.
vaccine. But
Hmm.
children are vaccinated in mass without any screening done at all. So
Hmm.
it's just left to the luck of the draw whether you're going to be injured or not.
It's definitely a roll of the dice, and we can do better than that. That's the point, is we can pre-screen children
Hmm.
for known allergens, because there's a in almost every insert there's a list of, hey, if your kid is allergic to these things,
Yeah.
there could be, this heightens the possibility of an adverse event. We can screen for that. We can also do something that isn't done, Heather, and we talked about it previously too, and I was so happy to hear you say this. After a vaccine is administered, number one, you should only get one vaccination at a time, period.
Yeah.
That's every vaccination is an infection. It's an
Every
artificial infection.
every veterinarian that I've ever taken an animal to
Hmm.
is
Hmm.
very firm about that. They don't want to vaccinate too young. That's
Hmm.
a big no-no. You don't want to vaccinate any animal that's too young.
Hmm.
You want to space them out only one at a time, only a killed virus vaccine.
Hmm.
You might think you need more vaccines than you do. They'll talk you out of them or see
Hmm.
what your situation is, what you might actually need to protect your animal. But then you go to a pediatrician and they're like,
Boop,
how
boop, boop,
many
boop, boop.
can we do today?
Hmm. Hmm. Let's get
Caution
them
to the
all
wind.
in. Well, and what's always the rationale with that? Well, we want to just we want to make sure to get them in, and we don't
Be
want
on
this to be
schedule.
traumatic on the child. They don't tell you about the money that they receive when they have a certain percentage of their patient population approved, I mean, proven
Hmm.
as vaccinated. They don't tell you about that. They don't tell you that that's weighing in to their decision making at all, which is unethical. It's actually a violation of their medical code of ethics. And yes, all physicians are required to honor medical codes of ethics, and you can file a medical complaint when your physician does not, to their board. It's something I've been teaching more and more moms to do, is when you are getting bullied, when you are getting intimidated, when that doctor is telling you, if you don't do this, your kid is going to die, that is a bold-faced bullying tactic.
Well,
And you,
moms need so much support like
oh my
that.
goodness, it's
They
so
really
much,
do.
so much. So we empower in this course, we empower moms to learn how to report to a board and be like, look, all you're doing is
Question
making
just
sure
for
there's a check and
mothers.
balances. Yeah, go ahead.
How would they find that resource?
The easiest thing to do is, once your doctor, whatever state you're in, every doctor is licensed by their state. So what you do is you go and you look for the board for medical physicians or medical doctors, and then that'll pull it up for your state. And right on every single board is a link for, so that you can file a complaint against that doctor if that doctor was attempting to bully you.
But how can a mother who's trying to protect their child get, like you're saying, like an advocate, someone who has actually helped them
You,
with support?
there are a lot of groups out there. I would encourage folks to check out some of the work that Brittany Cara is doing with Matrix Mothers, as an organization
Brittany
that
Carr.
is helping to be supportive of moms going through this process, knowing what a mom's rights are, knowing what a mom's can do and can decline.
Mm-hmm.
um, Listen, there's nothing wrong with a parent, mom or a dad, saying, you know what, thank you for the information.
Right.
I'm going to go home and talk about it and get a second opinion. We do this with everything.
Mm-hmm.
Talk with my family about it, and if we decide to move forward, we'll come back and we'll set up a schedule with you that's going to work. There's nothing wrong with that. That's how medicine, the relationship between a parent and a doctor is supposed to be a
Right.
partnership where the parent is at the head of the organization.
Mm-hmm. Exactly. And
You
that's
know,
what I keep saying with medical freedom is that there's such a an imbalance rather, an
right,
imbalance in that, a doctor and the patient should really be equal,
totally,
totally
100%.
equal. And what's happening is the patient's here and the doctor's, well, I have medical training, I have all this authority, I have all this expertise. Boom, you're
Right,
gone.
right. And you've even had the stories of a doctor threatening, if you don't do this, your kid's going to die. Well, I'm going to hold
Yeah,
off on it for a second. Well, if you don't do this, I'm going to report you to Child Protective Services.
right.
Right,
And
and
in the
it's like,
case of chronic pain patients, it's a lot of, you take these epidural steroid injections or I
mm,
won't give you pain medicine.
right,
I have seen
right,
that kind of manipulation all the time.
right. And it's just that right there. See, if you're, to your audience, you have the right to agree to or refuse any medical treatment.
Hmm.
And guess where this
But if
comes
you
from?
refuse, you're still out the pain medicine and you're still in chronic
Totally.
agony because you don't have the right to just go to the drugstore like you could 100 years ago and say, I want
Right,
somnifernum sap and get what you
right,
need.
right. So, and this is that little loophole that they work within. I'll give you this. I'll give you what you want, but you're going to do what I want. And that's conditional
All the
thinking.
time. Hmm.
And that's actually medically unethical.
And it's bullying. And
Hmm.
I do believe that there is an untold amount of PTSD and trauma
Yeah. Oh God. Yeah.
happening to medical patients.
Yeah.
Like I saw my partner told, well, if you want pain relief, get cancer by a doctor.
That doctor should be brought before their board for making a statement like
Hmm.
that. If you don't do this, your kid is going to die. That
Right.
doctor should be brought before their medical board and at least sanctioned on the standpoint of you are going to have to take some coursework on bedside manners.
Hmm.
And if we see you in here again for the same thing, we're going to threaten more extreme action against your license. You see, unfortunately, we live in a world, in a country where you have to hit people in the wallet to get them to want to change, and in the meantime there are good people suffering. And the way, for me, I've heard thousands of these stories of moms, of patients going in, getting really anxious. It's a very known medical condition that the heart will start racing and people will have a sympathetic fight or flight response upon the thought of going into a medical office, let alone
Hmm.
sitting in the waiting room. Most nurses know, I can't take your blood pressure until we have a little bit of a conversation, because the likelihood I'm going to get a false high reading goes
Right.
way up. People are stressed out going in to
Hmm.
see the doctor. We're anticipating bad news,
Hmm.
right? It's
And
it's
we
just
don't have medical freedom.
and we don't feel, exactly, we don't feel like we're in charge of the decision making. The
Right.
doctor's job is to inform and give the best series of options that they think are going to really help the
Hmm.
situation. That's our job. It's
Yes.
the patient's job to decide which of those and how they want to proceed. Now, a doctor might come back and say, well, okay, well, if with that in mind, I can't feel good about the treatment, I need to refer you to someone else.
Hmm.
That's totally fair.
Right.
But we have to make sure what we're doing in medicine is
You,
get back into a
that's a
partnership model.
a good point too. The referral system is
Mhm,
so broken, and
mhm.
I see no excuse for this because here we are. It's 2020. We have technology. We've had the internet for decades. Case in point, my partner who was searching for over 10 years for a willing surgeon
Mhm,
to do a back surgery.
mhm.
All this time the surgeon was out there, but just because he goes to one doctor, he's locked in with that doctor. That
Right,
doctor doesn't have anyone in their referral network who can do anything.
right.
You know, there it stops. And you have so many people being told that they're inoperable, untreatable, just because the doctor talking to
Right.
them doesn't have the expertise and doesn't have someone in their referral network. I think there should be some kind of website where patients who have a supposedly untreatable condition can be listed, that it can be searched by doctors from anywhere in the world.
Hmm.
So, like, if there's a doctor in Cambodia who just had a breakthrough about that
Hmm.
particular condition and is trying to find these rare patients to help, they can go on there and find that patient. It really, we are not utilizing the resources that we have.
Well, and we see that in when we have situations where entities want to control, what you can and cannot do. See, and I think that's what I love about what you're doing. This is we're talking about medical freedom. And medical freedom doesn't mean that, on a topic like vaccines, that you're pro or you're
Right.
anti-vaccine. What it says is that no, just you have the right to decide. And if you're the guardian
Mm-hmm.
for that person, you have the right to decide, which means very simply, because this is a thing about freedom that's so exciting. It means that you accept the risk of being free,
Yes.
right? It means that, yes, I understand that because I'm free, I may not, I may respectfully and politely decline the vaccine, but that in doing so, if the vaccine is as effective as as they say it is, and if it was, they wouldn't need to mandate it, wink, right? But if it was as safe and effective as they say it is, okay, that me not getting it is only a danger to myself. The argument that a person who's unvaccinated poses a threat to a person who's
Mm.
vaccinated is preposterous, but that's because they've influenced the narrative for most people to equate vaccination with a cure. And that's not what a vaccine is. Your
Right.
immune system is the cure. The
Mm-hmm.
vaccine is simply an artificial infection delivery system, an AIDS. Get that? It's an artificial infection delivery system so that when your immune system comes in contact with that artificial infection and all the toxic chemicals currently that go along with it, your
Mm-hmm.
immune system will mount a natural adaptive response to it
Right.
and create antibodies and have T cell response. The very same thing we're seeing with COVID without any vaccine happening,
Mm-hmm.
and you'll have immunity from it. That's how it works.
One thing that seems to really go against the whole theory that's being pushed about the herd immunity, that everybody has to be vaccinated in order for an individual's vaccine to work, is, well, what about the rabies vaccine?
Right.
Actually, that seems to be a pretty effective vaccine, at least for animals.
Hmm.
Um, and you vaccinate, say, your dog,
Hmm.
and nobody else in your home
Hmm.
is vaccinated for rabies,
Hmm.
but your dog is, and but that's not affecting your dog's protection. Now your dog goes out into the woods,
Hmm.
and it might encounter an animal that's infected or not. Any animal it's going to encounter in the wild is not going to be vaccinated.
Hmm.
Yet, if everything's going well for your dog, their vaccine is providing them protection in case they are exposed.
Hmm.
And that's really how a vaccine should work. I think we should use the rabies vaccine as the model for success.
I'm with you on that, and provided that the additional adjuvants in it are clean, green, and non-toxic. That's my only side issue as a
Right.
as an environmental doctor.
Mm-hmm.
With a lot of environmental medicine training is, and that which takes us back to that first point about ingredients. We can do better than this. We
Yes.
can make sure the ingredients are non-toxic, and guess what happens when we do that? The
Mm-hmm.
adverse events drop off a cliff.
Right. And
And now you don't
you
have
get
to
the
mandate
immunity. You get
anything
all
because
the
people will
positive.
want it. People be like, yeah, I want that. It's not rocket science here. You know what I mean? It's not rocket science that we've seen a dramatic
It's not a
increase.
hard sell. It's
Right.
not a hard sell to think you just get a little jab and you get immunity from a horrible, deadly
Right.
disease. I mean,
especially
that's going to
especially
sell
Heather.
itself.
Right, especially Heather, if they say, okay, we just gave you this artificial infection. Now, here's the nutrition that we need you to take for the next 14 days to make
Mm-hmm.
sure your immune system is powered up and goes into natural adaptive immunity very thoroughly, very quickly. And now, guess what? You're good to go. You're good to go. It's the easiest sell in the world.
It
But
is.
it's the impossible sell is when you mandate, because now you're telling people what to do, and Americans don't like that. And the
And it's not a
impossible,
cash cow.
right? And exactly. And
Yeah,
the impossible sell is saying, "Hey, I am going to tell you what you have to put into your baby. I'm going to tell you what have to put into your body." It's like, well, hold on, wait
right.
a minute. This is sovereign territory right here. You know what I mean? I decide what goes into it. I decide, you
But when
know,
you have that dialogue as equals,
right, right,
there's not the resistance.
right. It's
And
just,
it's just,
well,
I really see like we need a power shift.
we totally do. And I've been educating my audience this whole year on a simple idea.
Oh, I
It's
just have to jump in.
go for it.
Hello, radio listeners. You're listening to WGXE ACRA 90.7 FM. You are listening to the Medical Freedom Show with your host, Heather L. Martin. Today I am speaking with Dr. Henele, founder of the Energetic Health Institute and author of Energetic Health Volume 1. We have been talking about Dr. Henele's research and background in nutrition, in energetic health, and all those life-sustaining forces that keep us going, and also about our current allopathic medical system that is currently engaged in the fast track of the COVID-19 vaccine.
So, you know, uh, when we talk about that particular vaccine, Heather, there's there's just there there there's enough about it for everyone to be very concerned.
Yeah,
I have no intention of becoming Tuskegee Experiment 2.0,
me
Tuskegee
neither.
Experiment 2020. No, thank you. I am not going to be mandated into it. I am not going to allow my child to be mandated into it, and I am not going to expect other people to have their children mandated into it in order for my son to be safe. My son is safe based upon the healthy habits that we employ nutritionally and otherwise in our home. You know what I mean? And this is that inherent risk that you take with freedom. That, yeah, something bad could happen, but that's true of every minute of
Yeah.
our waking life. That's how it works. I didn't want to cut you off. What were you going to say?
No, I wasn't about to say anything.
Oh, okay. Oh, I can keep going. I think that what's so important for us is to understand that fear makes fools rush in. If fear
Yeah.
turns us into fools and it makes us rush in. And so I've been telling my audience all year. I was doing a PSA every day through pretty much through the end of May on COVID-19. I go and I look at every single state health department, and I give Americans the data that isn't being reported on the mainstream media. If you're going to report a fatality, report a recovery. So to give us the numbers. If you're going to report a positive test, report the total number of tests. Give
Mm,
us a full view of the situation, because I'm not here to be influenced. I'm here to
right.
be informed. And there's a difference. And media has moved into this influencing role of, let me tell you what you need to know. Let me tell you how you're supposed to feel about this. Let me tell you what to think about this. And I
Hmm.
and I just it's repugnant to me, because they're supposed to be the fourth unofficial fourth branch of our government and checks and balances. But when you look at their advertising and who advertises on, why they're not anymore.
Right.
Right.
They're
But
pushing their war on drugs to continue since they
right,
legalized cannabis. They need
right,
a new drug to go after to continue having property seizures and uh,
right. That's
driving that revenue for the prison industry.
right. It's oh well, that's a whole nother
And one
topic.
of the things right now, they're talking about defunding the police. And I keep talking about, well, if you end the drug war, you're already majorly defunding the police right there,
Hmm.
because that's the big cash cow. That's where they're getting the revenues from property seizures and cars and houses and boats and all these things that are big money items, and that gets generated back into that community's law enforcement system. So are you looking at the little line on the county, state, or city budget, or are you looking at really how police
Right.
are funded? Because people don't seem to understand really how they are funded.
Yeah, the defund the police is a clever slogan. that has just tremendous implications,
Yeah.
with it on both sides of the argument. And I think what we're all agreement on, which is very interesting that we're not talking about what we're all agreement on, just accountability for bad police,
Right.
right? That's all we're
Absolutely.
interested in. It's like,
Hmm.
listen, let's just make sure that we are majorly that there is an accountability system and that they can't hide behind a blue line that punishes people for whistleblowing in that same community.
Absolutely. And I'd also like to see that extended to the judges. Like these judges should be
Yes.
audited who are giving harsher sentences to one demographic than they are to another. I mean, there should be
100%.
a record of that. That should be provable.
Yeah, well, it is provable. It's just what do you do? Because see, and this is the whole thing that's so interesting about our because we're talking about freedom, right?
Hmm.
Freedom means we live in a democratic society. Well, the foundation of democracy is checks and balances. And what do we see? Every time there is no oversight,
Yeah.
every time there is no checks and balances,
Right.
corruption erupts,
Hmm.
right? And that's what we're seeing. We see it in the vaccine industry. There's no the checks and balances. This is what I want your audience to understand. Checks and balances for citizens against companies and the products that they create is civil litigation. You look up car seat manufacturers, and when they've had a defect in their product, they've paid out millions of dollars to one family for a defect. Could you imagine what would happen to the pharmaceutical industry if they were held civilly liable for
Hmm.
vaccine injuries? It would bring the industry to its knees, which then does something very incredible because the industry wants to continue. It forces the industry to change.
Hmm.
It forces the
Right.
industry to be better, to put out a better product, a product that is truly
Exactly.
safer. And we can put in mechanisms like we were talking about before we went on the air about after you've had the vaccination that 2 weeks later we check for antibodies to see and make sure that the
Yeah.
vaccine
And see how
produced
you
antibody.
feel. Did you have any weird
Yes,
reaction? Have you not been able to sleep for 2 weeks?
right.
What's going on with you? And when we were talking before about the pediatricians and how they are in such a rush to
Hmm.
get the most vaccines into the youngest child
Hmm.
possible, it really seems to be, get the most vaccines into someone who is pre-verbal so they cannot describe their symptoms and they can't point a finger.
And before their immune system can effectively get into natural adaptive immunity, most people don't know
Yeah.
this. Immunologists know this, but most people don't. That the baby's immune system does not gain full immunocompetency until typically around 24 months. Any
Hmm.
vaccines administered prior to 2 years of age are, forgive me for saying this, a money grab. They're
Yeah.
not based upon science. They're not
Right.
based upon our understanding. If you inject a newborn baby, Hep B vaccine, right? Baby just came out the womb. Hep B,
Hmm.
this is what actually got me started, Heather, on researching this because my son was, and I was like, I want to be prepared to answer this question.
Uh-huh.
Should I vaccinate him or not? I started doing all this research on the Hep B vaccine, and I was just like, wow, why are we giving this to children? First of all, and why are we giving it to children literally seconds after they've come out of the womb? Is the situation that dire?
Yeah.
We're giving them an artificial infection, and that's all. I know we say vaccines. I'm just going to continue to call them artificial infections. I
Hmm.
want the world to realize what they're not a cure. All they
Right.
are is an artificial. So, are we going to really give a brand new baby, the umbilical cord just got cut? We're going to give that baby an artificial infection as it's hello into the world, and it doesn't even have an immune system that can handle that. So we now put that baby in a challenged situation. The opportunity for an adverse event skyrockets. Don't get me started on SIDS, and them saying
Right.
that there's no connection. No, I'm not
Hmm.
stupid. I know you want me to be, but I'm not. And what I want folks to understand is if that baby isn't nursing, isn't being
Hmm.
it's mama's milk, that's the vaccine.
Yes.
That's the best
That's
vaccine that
something
baby can ever
I
get.
wanted to bring up too, is that there's the immunity that is passed from mother to child, both through the
Hmm.
gestation process and through nursing. And wouldn't it be wise to first titer a child and see what natural immunities it already has? And also, wouldn't it be a goal, or at least an ideal goal, that your vaccine might be transferable intergenerationally? And should
Listen to
we
this
be
woman.
trying to see if that's happening?
Listen to this woman. This is this, and how do we get to these places? Because we're asking questions,
Mm-hmm.
right? This is the thing. I've lost some friends during this COVID-19, not because they passed away or were sick, just because they can't stand what I'm saying,
Yeah.
basically about it. And it's like, I'm not saying anything. I'm just asking questions. If we can't ask questions and get a good answer for those questions, we're not living in a free society. To me, that's the fundamental thing. If you're asking questions, it means you're thinking. It means there's a critical process going on in your mind, and it's so beautiful and it's so wonderful because it's those critical processes that make our world a better place. We don't think,
Right.
at one point in time, we thought that it was okay for expecting moms to smoke. That was a medically established, this is an okay thing to do. But
Even kind of
now,
recommended.
right, but now, yeah, be cool. Here, look at that great little, and look at, she's checking out the new sofa that she's going to buy. You know, and you're looking at it, you're going, I am repulsed that we thought at any point in time that that was okay. But how did we get to the place we are today? Because we used and applied critical thinking and asked
Mm-hmm.
questions. Why are babies coming out still? Why are babies coming out blue and cyanotic? Why are babies coming out with developmental delays and errors
Why has
of
autism
development?
increased 300%?
I want to know. It's a
Yeah.
good question. And here's what people say. Well, that's been debunked. That it was proven that it was. No, it hasn't. There was one study, the Finland study, one study. And guess who funded that study? A vaccine manufacturer funded that study. And the
Mm-hmm.
follow-up study to that was done by the exact same authors. And when you look for the funding statement on both of those papers, guess what? Who funded it? The same company that makes the vaccine. That completely is a conflict of interest and completely invalidates anything that they found there, let alone that, guess what wasn't a measurable criteria during that study? Autism, because autism hadn't yet been clearly clinically defined globally. So it wasn't even an option for someone on a follow-up surveillance to
Mm-hmm.
check and say that that happened. So what they're doing is completely misleading
Yeah.
in
It's
that study. It's
always
horrible.
important to look at who are the funding sources
That's the
behind
first
any
thing I
study,
look at.
any publication. Even going back to when we start out talking about how allopathic doctors are educated, even when
Hmm.
they're in college, how are those textbooks produced? You'll find a
That
lot of pharmaceutical industry money behind them.
a person who asks questions is a patriot. That's
Well,
what
I
being patriotic is,
consider
asking
myself
questions.
somewhat
Hmm.
patriotic to my
Hmm.
land and countrymen.
Hmm.
Yep. Um, and you were talking a bit, I wanted to give you a chance to share your knowledge with our audience a little bit about how one can protect oneself from COVID right now, in addition to the masks and the hand washing and the sanitizer.
Well, I appreciate that. Let me qualify this statement by, of course, saying, make sure if you do have symptoms, that you either go in and get tested and then quarantine, or are hospitalized and follow the directions of the people that are working with you. All right. If you feel like you have symptoms and you're unsure, but they don't feel severe, make sure you do what we always do when we're sick: stay home, right? Have a little bit of some good old organic, chicken soup with a whole bunch of good organic veggies in it, and do what we normally do, because the probability of recovery, and we have looked at over 3 million positive cases, Heather. We've looked at the demographic data on this, something that's not being published
Mm-hmm.
widely. We've been following this since the first week of August. Let me share some stats with you. And we just had our first paper published by the Children's Health Defense, and we're having our second paper published by the Children's Health Defense tomorrow. We have a series of 6 papers scientific peer-reviewed papers that we're getting published right now. So we've looked at this very thoroughly, and we go down to the state health department level and we acquire all of this information. What we want folks to know is that probability of recovery in the 0 to 19 age demographic is 99.96%. There have, as of,
That's
and
encouraging.
I just finished a data update last night. There have been only 63 reported fatalities in the 0 to 19 age demographic nationwide, and that includes probable cases where we don't have lab confirmation on them, okay?
Mm-hmm.
The probability of recovery in the 20 to 49 age demographic is 99.6%.
Actually, speaking of the hospitalization, and
Yeah.
one of the protocols for some patients has been intubation.
Yes.
There's a doctor in my state, New York, who's he's got a few YouTube videos out,
Mm-hmm.
and what he's postulating is that the treatment protocol for the intubation is
Mm-hmm.
setting the pressure on the respirator too high and actually doing damage
Yeah.
to people's lungs. And what's really astounding to me is I hear he's making YouTube videos about it.
Mm-hmm.
And you would think a doctor would have the authority to say, I don't think this is working. I'm going to try something different.
Mm-hmm.
But apparently they don't. It's like they have to
We
follow a
don't.
blanket
In
protocol.
in March, the FDA was very clear to all licensed physicians that if you discuss any other treatment than the one that we authorize, you will be brought before your state board and your medical license will be threatened. And that includes vitamin C. I have colleagues who have
Yeah,
talked
it
about
makes me a little nervous, even though about recommending going to a hospital or even,
the stats we're
getting
publishing
tested,
tomorrow.
because it's possible that people are getting damaged by this protocol.
The
But of course, we
stats.
can't breathe naturally. I guess you don't have
Oh,
any choice.
well, the stats we're publishing tomorrow show that people in the 50 plus age demographic that are hospitalized have a 52% likelihood of fatality currently.
Mm.
And that's across every state. And we suspect a lot of that is due to the treatment. One of the things we've been advocating for, and I will continue to advocate for, even if they want to take my license, is that every single person who is admitted should be given a test to assess nutrient deficiencies, and that should be the primary treatment, because we have studies that show that amounts of vitamin D, vitamin B12, and magnesium at the very least, at far below therapeutic amounts, have been amazing in creating positive outcomes in conjunction with allopathic interventions. So we have studies from around the world that are showing the efficacy of nutrition with this. But if I, as a physician, try to say that this will help keep you safe from COVID or help you recover from COVID, I could lose my license.
Right.
That's how crazy the
We
scenario
don't
is.
have medical freedom, and
So
doctors are not allowed to freely practice medicine.
we're not. So what I can say is this will help your immune system because we have all the peer reviews on it. And if
Mhm.
your audience wants to use it and they get better, don't blame me. I can say that as well.
Mhm.
So the recommendation, and I have a video on this, and I'll share a link that you might be able to share with your audience as well.
Yeah, on
And
our Facebook page, please feel
yeah,
free to share any of the links that you've talked about. That's what
perfect.
it's there for.
But basically what I
And
did
by the way,
was
that's facebook.com/Medical Freedom Radio Show.
awesome. What I did is, instead of saying this is what I think someone should be taking, I just said, what you can't stop me from doing is telling people what I'm doing.
Mm-hmm.
So
Right.
I can share what I'm doing. And so I have a
Mm-hmm.
video on sharing what I'm doing, and I always couch everything with saying these are for educational purposes only,
Yep.
not intended to replace the advice of a
Right.
licensed
We
physician,
have
so forth.
about 60 seconds left to our show. Dr. Henele, I want to thank you again for being my guest on the show today. And I want to thank all of our listeners for tuning in, and WGXC ACRA 90.7 FM, your community-supported radio. If you'd like to become a sustaining supporter of our radio station, please visit us on wgxc.org. And that about does it for our show today. Thank you, Dr. Henele.
Thank you for having me, Heather. I really had a lot of fun. Thank you so much.
Thank you so much. See you next month.